Now let's get you to the coronavirus outbreak and the effort to slow down the spread of the virus. Later today, Governor Greg Abbott plans to address the Lone Star State on the latest efforts in the fight against COVID-19. This comes days after he issued that executive order that closed dining areas in restaurants, bars, and gyms across the state. So that address is slated for 3 o'clock. Meantime, Fort Bend County shut down beauty salons, tattoo parlors, movie theaters, and other gathering areas. And in Sugar Land, the dog park, playgrounds, and restrooms are closed until further notice. All this as the number of Houston area coronavirus cases grows. At last check, the city of Houston, Harris County, Fort Bend County, Montgomery County, Brazoria County, Galveston, Wharton, Grimes, and Chambers counties all reported new cases. Those bring our area to a total of 141. But that number could spike as more people get access to testing. Anayeli Ruiz explains how the city of Houston's first free drive-through testing site is expanding its services.
That's right, the site is opening up this morning at around 9 a.m. They're asking anyone with COVID-19 symptoms or anyone experiencing any chronic illnesses to make an appointment. They're asking everyone to call ahead and not show up. If you show up, you're going to be turned away. The appointments are from 9 a.m. to 3 p.m. The site will only accept people with a unique identification code obtained through the screening process. Those with chronic illnesses like heart disease, asthma, cancer are eligible for a free test. Even people with weakened immune system and pregnant women. Previously, they were only testing healthcare providers, first responders, and people over the age of 65 with symptoms. Now, 3 more testing sites are expected to open in the coming days. The locations of the testing sites are not being released to prevent people from showing up and being turned away because they did not complete the screening process. Insurance information will be collected at the sites, but payment will not be accepted. Well, people experiencing any kind of COVID-19 symptoms like difficulty breathing or fever should definitely call the Houston Health Department. Anayeli Ruiz for H-Town Rush.
Anayeli, thank you. We have that number on KHOU.com. Well, first, it was a protective gear shortage. Now hospitals are running out of intensive care beds. Collectively, hospitals across the state held more than 8,800 intensive care beds. Since the coronavirus pandemic started, almost half of hospitals don't have any allotted beds at all. To help, Governor Abbott announced a temporary waiver for hospitals to set up tents and increase bed capacity, but that doesn't solve all problems for hospitals.
Frankly, the biggest challenges most hospitals are concerned about is staffing.
To overcome the nursing shortage here in Texas, the governor's letting healthcare workers from out of state practice here. That's if their own state doesn't need them. Now we want to give you a look at the response to the coronavirus across the nation. As Michael George reports, President Trump and other top officials insist that they are moving quickly to flatten the curve and stop the spread of the virus.
President Trump has approved a disaster declaration for New York State.
This is the first time in our nation's history that a president's used the Stafford Act to declare a major disaster in response to a public health crisis.
The designation opens the way for billions of dollars in emergency federal aid to be sent to one of the states hardest hit by the coronavirus. President Trump said other parts of the country, such as California, may also receive disaster aid. New York, California, Illinois, Connecticut, and Oregon are all taking measures to restrict residents' movements outside their homes. The nation's top infectious disease expert says mitigation efforts are working, but it's hard to say how well.
We know we are clearly having an effect, but we can't quantitate it for you accurately now.
On Capitol Hill, senators are spending the weekend trying to finalize details of a $1 trillion economic stimulation package. The bipartisan bill includes relief for small businesses, loans to impacted industries, and direct cash payments to individuals based on income and family size. Joanne Imwali is a nurse at a hospital near Sacramento. She goes into the rooms of patients who have infectious diseases, such as the coronavirus.
We're coming in and taking care of patients that have something that's infectious that we could actually get and potentially die from.
Healthcare workers are facing a critical shortage of masks. Vice President Pence, who's leading the White House task force, says masks are being prioritized to areas in greatest need. He urged companies and dentists to donate masks to hospitals. Michael George, CBS News, New York.
Big changes if you rely on Metro buses and light rail here in Houston. Starting tomorrow, your ride is going to be free. Also, you'll get on and off through the rear door to keep drivers safe. As we continue to social distance, certain seats will be marked unavailable. Now, even though school buildings are still closed, at least until the end of next week, classes will start up again online. Houston ISD announced online lessons are ready for each grade level. You can go to your student's school website to learn more about that. Meanwhile, Spring ISD will begin its grab-and-go meals tomorrow. So the district would have returned from spring break tomorrow. Instead, it's closed until at least April 10th. There are 6 locations where families can pick up breakfast and lunch for their students, and those services will be available Monday and Wednesday from 8 to 11 in the morning. We have a full list of times and locations from multiple districts offering meals on KHOU.com. For weeks, we've warned you that the elderly and people with underlying health conditions are most at risk for the coronavirus, but young people aren't off the hook. Sherman Chow connects the dots.
The CDC has some bad news for people who thought the coronavirus was only a problem for the elderly. New numbers prove it's not. Let's connect the dots. That data from the Centers for Disease Control and Prevention shows that 40% of all people being hospitalized by this coronavirus are between the ages of 20 to 54. They are not dying at the same rate as older people, but their symptoms are severe enough to warrant treatment at a hospital. The new numbers are from the U.S. and do not include people who returned to this country from China or Japan infected. And the CDC stresses that some of these patients are still hospitalized, so we don't know the outcome of their cases. The data also alarming to medical experts. They're concerned that people under the age of 70 believe they can't be affected by this virus, when in reality, they are helping to spread it further. Connecting the dots, I'm Sherman Chow for H-Town Rush.
Sherman, thank you. Remember, you can always get more information about the coronavirus by texting the number that just popped up on your screen. It's 713-526-1111. Text the word facts, and we will send you a link with our most up-to-date information. All right, it is 7:09 on this Sunday morning. We have heard your questions about whether it's safe to give blood during this coronavirus pandemic. Our Verify team gets the answer on the other side of the break.
The usual 10-day waiting period to file for unemployment in Texas has been waived, so you can apply online right now by visiting twc.texas.gov or by calling 1-800-939-6631. If the coronavirus affected your job, make sure you have all your former employer's information when you apply.